Public health is about helping people to stay healthy, reducing the risk of getting diseases and injuries, and protecting them from threats to their health and well-being. Essentially, we can approach public health in three ways: protecting health, such as minimising the spread of diseases like TB or measles; improving health, for example, education programmes or behavioural change; and by making sure that we have the right services in place that are effective, efficient and equitable. Public health problems are diverse and can include infectious diseases, chronic diseases, emergencies, injuries, environmental health problems, as well as other health threats. Regardless of the topic, we take the same approach to public health by following four general steps. First, what is the problem? Using the available evidence, which might be surveillance data, needs analysis or outcomes framework. What is the cause? For example, are there factors that might make certain populations more susceptible to disease? Is there something in the environment or certain behaviours that might make people more at risk? What can we do about it? What does the research tell us? What are the guidelines? What are the recommendations? And whether the proposed intervention, does that make sense for our population? And then finally, how do we do it? How can we implement this intervention? So given the resources we have available and what we know about the affected population, how will this work? Here we'll implement change management and behavioural change theory as well as evaluations. So public health actions are system-wide and at scale. They're evidence-based, collaborative, outcomes-driven, addressing health inequalities as well as promoting value for money and cost effectiveness. The function of public health is to improve the public's and protect the public's health and reduce health inequalities between individuals, groups and communities through coordinated system-wide action. Public health skills can be grouped into three areas: technical, which are things like needs analysis or health promotion, health protection, critical appraisal of evidence; context, so this is where we bring in policy and strategy development and political awareness; and then delivery, so leadership and communication, as well as community development where needed and programme management. The Birmingham Public Health team has been supporting the CCG's prioritisation process by undertaking evidence-based scorecards for each intervention that's been considered by CPAG, the CCG's Clinical Priorities Advisory Group. These scorecards are based upon a critical appraisal of the available evidence. Critical appraisal is the process of carefully and systematically examining research to judge its trustworthiness and also its value and relevance in a particular context. We need reliable information about what might harm the population, what sort of care is best for those who are ill, and what services represent good value. Good research is needed to generate reliable information. Research involves designing a study, gathering data, and collating and analysing it to produce meaningful information. However, not all research is good quality, and many studies are biased and their results untrue. This can lead people who read it to draw false conclusions. We use critical appraisal to tell whether a piece of research has been done properly and that the information it reports is reliable and trustworthy. Evidence comes from various research studies. A study is an experiment or an observation looking at those people who have an exposure, an outcome, risk factor or intervention versus those who do not in a very specific population. Epidemiological research is research that's concerned with how the determinants of disease are distributed in a population. It's about what happens in that population, not really about why it happens. It covers a wide range of study types, from things like cross-sectional surveys right up to randomised controlled trials. Each of these studies have their uses. However, we consider the highest quality evidence to be from well-conducted randomised controlled trials and well-conducted systematic reviews and peer-reviewed evidence. most important thing when undertaking an evidence review is making sure that the question is correct. We're using a PICO question in our scorecards, where PICO is the population, the intervention, the comparator and the outcome that we're interested in. There's often a balance between the question being broad enough to ensure that there's sufficient evidence available, but also making it specific enough to the population that we need so it's relevant for our needs. One of the ways that public health specialists decide whether they believe what a study is telling them is by assessing its validity. Validity is the degree to which inferences from the study are warranted, taking into account the strengths and weaknesses of the study design. There are two types of validity that we're interested in. There's internal validity. How reliable is this study? Could this outcome have happened anyway? So is it chance or random error? Are there any errors in the way that the researchers have conducted this study? So is there any bias? Is there any confounding? So is there anything that the researchers couldn't do anything about that might explain the situation? Then we also look at external validity. So that's once we believe that the study is valid, would that work for us here? What extent do these findings can be generalised to our population? So internal validity is always our first priority. There's no point generalising results that we know are not true. The CCG uses a scorecard to rate interventions according to the strength and quality of evidence, the magnitude of health improvement benefit, prevention of future illnesses, supporting people with existing health problems, cost effectiveness, and also whether the intervention addresses any health inequalities or inequities, and then whether the intervention delivers national or local requirements or targets. Once each intervention is scored against the criteria, the total score is tallied. Those scoring above the commissioning threshold may potentially be commissioned, and those scoring below the threshold may potentially be decommissioned to release funds for investment elsewhere. Individual public health specialists have been assigned different evidence reviews. They'll undertake detailed scoping and evidence gathering. We'll also make sure that the PICO question is correct for the intervention, and with liaison with the CCG and also the CPAG group. We'll have regular scoping and moderation meetings with our wider group of public health specialists, and at those meetings we agree the content and the scoring, and once that's gone, each scorecard has gone through moderation, we will send to the CPAG group for consideration.